Hello, I'm Dr. Robert Koff, and we're about to go beyond the Terminus. Today, we're going to talk about the referral process, focusing on radiography and history. There are times when you need a diagnosis, when you may feel that your patient would benefit from a second opinion, or simply when you wish to refer a patient for treatment. And that may not be just for endodontics, it can be to any specialist. How can we make the referral process as efficient as possible? Well, one of the ways is by providing good images and patient histories when you refer the case. At a minimum, any case being referred for an endodontic consult should have a well-angulated periapical image taken with a paralleling device and a bite wing if it's a posterior tooth. Why the bite wing? Because periapical images frequently hide caries under crown margins and large class 5 restorations. Bite wing images also tell us how the tooth opposing the suspect tooth is restored and how it is occluding. Are you taking bite wings after you cement your crowns? Patients are sometimes referred to me for persistent symptoms after the crown cementation because the dentist assumes that the symptoms are pulpily related. The bite wing image shows cement left under the proximal crown margins rather than endodontic factors are causing gingival inflammation and the symptoms. I frequently see symptoms of cracked teeth that are opposed by crowns. So when I suspect symptoms of a cracked tooth, one of the first things I look for is what is opposing the suspect tooth. Also, pain can be referred from the opposing arch. It's helpful to know whether a recent large restoration has been placed in an opposing posterior tooth. So, bite wings should be part of the normal preoperative diagnostic evaluation. It's easy to ship off the last panoramic image with a note saying, this is what we've got. But is that fair? How old is the pan? How good is the resolution? Have any of the restorations been replaced since it was taken? How long does it take to image the tooth today with a good PA and a bite wing? With the prevalence of digital radiography, limited exposures, and the ease of file transfer, this is a no-brainer. Speaking of good PAs, what kind of images are you sending? Referral images need to be of diagnostic quality for them to be useful. Endodontists say that one of the biggest complaints about referrals is that the images that are often sent are either cone cut, poorly angled, or not even of the correct tooth or quadrant. Remember, your images are your signature. Be proud of your images, not apologetic. The history portion is similar. It's very likely that the specialist has never seen the patient before. Simply circling a tooth or ticking a box on a referral form is a poor way to introduce your patient to a fellow professional. Yes, it may take a minute or two of your time to have your assistant or you enter a referral note, but do take the time to review the history of the area. Many mature practices have patients with wall-to-wall crowns. Today's radiographs may not show much other than a full posterior side of radio-opaque crowns that give little information about the condition of the tooth before they were crowned. Were there any cracks? Were there deep restorations? Maybe a pulp cap? Send any old films that may have been taken before you treated or restored the case or seated that crown. In cases where patients have diffuse symptoms, those films may be the key to trying to figure out which tooth is the most likely source of the patient's current complaint. You can never send too much information with the patient. While you're doing that, make sure to include how you plan to restore the tooth after the endo is completed. Is the crown to be replaced, or is the access to be closed immediately after the endodontics by the endodontist? Your endodontist can reinforce the need for the patient to return to you for restoration, but only if he knows what you have planned. Remember, our job is not only to endodontically treat the patient, but it's to educate them and reinforce your treatment plan. In order for us to do this, we need to know what your treatment plan may be. So before you simply circle a tooth number on a referral form and tick one or two boxes with a quick please do endo, remember, your patient and your referral specialist deserve better. Good teamwork relies on communication, and we know that the optimal results are obtained when we all work together as a team. Remember, when we do the right thing, we all get better, clinicians and patients. Thanks for tuning in, and I look forward to having you join me on our next trip when we go beyond the Terminus.